sound needed renovation. Appreciate your sound needed renovation. Sound needed renovation.
Music brings us together, even when we're apart. That's why we support Canadian musicians, festivals, and award shows. It's just one of the ways TD's Ready commitment helps build a more inclusive tomorrow.
Atiga Mackenzie, Labrador Miungavunga. Before we begin, we would like to acknowledge that this event and the Halifax Pride Festival take place in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered under the treaties of peace and friendship with the Wabanaki peoples. We recognize that reconciliation requires action in support of words. We commit to working with and supporting Indigenous communities, and it is important that we work towards identifying and uprooting all systems of oppression.
Halifax Pride is dedicated to providing space that is accessible, inclusive, and free from oppression, harassment, and discrimination. In this space, we will treat each other with respect and dignity, regardless of age, race, gender, gender identity, sexual orientation, levels of ability, and all our other diverse identities. Halifax Pride stands in solidarity with the Black Lives Matter movement to end police brutality and violence against Black communities across North America. African Nova Scotians and Black people have the right to live free from oppression, violence, and systemic marginalization. Halifax Pride recognizes our history and ongoing contribution to the marginalization of QT BIPOC folks. Since the beginning and to this day, the queer movement remains a protest against systems of oppression, including those that disenfranchise Black, Indigenous, and people of color. As such, Halifax Pride commits to actively operating in a more anti-racist and anti-oppressive framework by prioritizing QT BIPOC voices and leadership in our spaces. Please visit our website to see some of our ongoing initiatives championing, supporting, and working with QT BIPOC people. We're holding ourselves accountable and allowing queer individuals to also hold us accountable for our shortcomings. We commit to engaging in discussion and following the leadership of traditionally marginalized and disenfranchised queer individuals. Throughout this year's festival, you may reach out to any one of the board members to provide comments or express concerns that you may have. We have also set up an anonymous survey to provide feedback for all events. So please visit the link on the screen or go to our website to complete the survey. And lastly, supporting Black, Indigenous, and people of color and their leaders in actions calling on government and organizations to create meaningful change, such as adopting policies that begin to dismantle systems of oppression. This year, Halifax Pride has required that all corporations who wish to participate in Pride must sign an agreement to support QT BIPOC folks in several ways. The agreement has been published on our website and is available for the public.
Hi there. I would like to welcome everyone who is joining us online today for our panel discussion, which is focused on trans and gender diverse health and navigating the healthcare system in Nova Scotia and more broadly as well. My name is Kaitrin Doll. I use they, she pronouns, and I work as the Pride Health Coordinator for the Nova Scotia Health Authority. I'm really honored to be here today with this fantastic panel to talk about some really important things. So I'm going to start off by introducing our panel. First, we have Tye Silver, who uses they, them pronouns. Tye identifies as trans non-binary. They have been doing community work in Halifax for 14 years. That has included working at a youth shelter, youth center, and now as an intensive case manager at the North End Community Health Center. A part of their work journey has been working with trans and non-binary folks. And in their current role, they have been involved with the North End Community Health Clinic, becoming more informed and training and working with trans and gender diverse folks. Welcome. Next, we have Dr. Adrian Edgar, who uses he, him pronouns. Adrian Edgar is a family physician who has been involved in HIV research since 2005. In 2007, he became the first transgender person to gain admission to a medical school in Canada. He has been a member of trans and queer-centered primary care teams in Hamilton, Toronto, Vancouver, and now Fredericton, where he is the medical director at Clinic 554. Adrian is a past president of the Canadian Professional Association for Transgender Health, CPATH, and participated in both TransPulse and TransPulse Canada research projects. Adrian was selected as New Brunswick's Pride Hero in 2018 and was part of the Clinic 554 team nominated to serve as Grand Marshals for the Fierté Fredericton Parade in 2019. Welcome, Adrian. And next we have Rae O'Neil. Rae O'Neil uses she, her pronouns. Rae is a local IT person, maker, cosplayer, activist, and proudly transgender woman. Rae has been out for 4 years and is very loud on Twitter under the name Neo Vagina Evangelion. Formerly, Rae sat on the NSRAP board. She has spoken at a few previous panels with regards to the challenges of navigating the current healthcare system while trans, as well as methods to stay safe on social media. Also today, you'll notice that we have ASL interpreters. So right now, interpreting for us, we have Charlie. Charlie uses he, him pronouns. And Charlie will be switching out with Krista, who uses she, they pronouns. Thank you so much for being with us here today. All right, so to start off the panel today, what we're going to do is each of our panelists will just speak to their connection with the topic and just share a little bit of their experience, both personal and professional in this area. So we're going to start with Tye. Take it away.
Hi. It's important to remember when you're thinking about gender that it's a wide spectrum and everyone's journey is a bit different. There will be similarities, of course, which is where as a trans and gender diverse person, you should try your best to determine what you need. What is the best fit for you, for services? What is a fit for one person like me might not be a fit for somebody else. So it's good to kind of be aware of what your needs might be before seeking healthcare, but some people don't, and that's also okay. Unfortunately, for too long, gender was putting people into narrow boxes, but that method has not worked for many for decades. For those seeking healthcare and trying to navigate the healthcare system, I would suggest trying to have a support person along the way because the process will come with many bumps in the road. But although there will be bumps, it will hopefully be all worth it in the end once you get to your end goals. It is good to be aware that when seeking trans or gender diverse healthcare or healthcare as a trans or gender diverse person, which should be under the same umbrella, but we're not there yet, that unfortunately those providing care are often cis people, although they're often well-intentioned. As a trans person or gender diverse person, we should just be aware that when we're going for healthcare, just that there might be words said that, you know, might be offensive, or certain clinics might not be totally trans inclusive. So just trying to be kind to yourself and trying to have supports with you, because it might not be a smooth process, but it will be a process that's worth it. Things to keep in mind are that if you have a doctor already and you feel they're not giving you appropriate care because of your gender, to reach out to organizations like the Sexual Health Clinic or Pride Health. South House is also a ally in the community, and there are other ones also that other people might touch base on. You can try to switch doctors, which will be difficult, but you can try if you try to speak up about your experience. And I just encourage people to keep pushing yourself, to remember that the process is I just made a mistake, sorry. For folks seeking care, it is helpful if you can come to the closest proximity you can to knowing what you want in regards to transition. Because when you're seeking healthcare, unfortunately, the professionals need to see that you're almost pretty much 100% sure of what you want, because they need to tick off certain boxes to be able to write you a hormone script, or to you need assessments to get surgeries. So it's good to be aware of that you need to articulate to people in the healthcare profession that what you know you want, which is kind of a con, because it sucks that we have to prove our transness to healthcare professionals, but just being aware that that is part of the process. Just being aware that There are processes you do need to go through. It's not just going to a doctor and getting what you need, that you often need to make several appointments and then get letters and then go on wait lists. But although it sounds negative, like I said before, it's definitely worth it. But just knowing what you have ahead of you before you start the process is good, just to get yourself ready mentally. Yeah. And I also just wanted to mention quickly around healthcare professionals and the healthcare systems, how right now it's set up that it's mostly cis people providing trans healthcare, not exclusively, but a lot. So there needs to be a shift where there's more trans and gender diverse people providing healthcare. And there's a lot of value in this, and that people see a reflection of who they are. They have someone who has experienced similar things or better know how to navigate the systems. It's not saying that cis people aren't well-intended, but it's always better to have somebody providing care for you who understands what you're going through. Yeah, that's what I wanted to start with today. Hopefully that all makes a little sense.
Yeah, that was great. Thanks so much for sharing that. I think that's a really great way to start us off. And we'll kind of come back and I think we'll go into some of that a little bit more. Just before we go over to Dr. Edgar, I just wanted to let the folks who are listening to the panel online know that we will be taking questions and we would love to hear from you. So if something comes up for you, put it in the chat box and then the questions will be brought to me. I'll read them out and the panelists can answer either everybody or whoever feels they would like to answer could do that. So really, we encourage you to engage with the panel. Like we're here to chat with you. So yeah, start thinking about questions because I think we'd love to hear from you folks. That said, I'll turn it over to Dr. Edgar.
Okay, thanks for inviting me and for everyone who's there and who's online. I wish I was there with you in Fredericton now. But happy to be here, happy Pride. Okay, I want to start by talking about a few historical challenges trans people have faced and then move into a modern context. One, because I think it's important to see how much we've already been able to fight and change. And two, because I think it's really important to start from a place of hope and pride. So when I started working in trans healthcare, there was still a requirement for what was known as a real life test or a real life experience. And that asked people to live in their preferred gender identity for a minimum time. At that time, it was 2 years before being allowed to access hormone therapy. And so this forced people into positions where they faced discrimination that exacerbated, negative experiences of mental health. And we've removed this requirement. In order to change an identity document like a birth certificate or a passport, driver's license, etc., to reflect the person's gender expression and lived gender identity, genital surgery was required, regardless of whether the person wanted it. So this forced the castration of every trans person in Canada in order to have an ID that provided us just safe passage and existence through the world around us. And we've removed that requirement. Sorry, it makes me quite sad to go back to that place. I'm just having an emotional moment, sorry. Sorry. Gender identity and gender expression were not legal terms, and so there was no explicit legally protected human rights against discrimination in areas like employment, housing, healthcare, childcare. For example, if you were a trans person and you were involved in a divorce, you had no hope of having your children afterwards. So now we have sweeping federal and regional protections encoded legally. Access to hormone prescribers was more limited, much more limited to specialists like psychiatrists and endocrinologists. But now nurse practitioners and family doctors are the norm in most parts of Canada. So trans people and our allies have come a long way to create changes towards a gender-affirming society and a healthcare system that's more, I guess, gender respectful. And I say all this just to highlight that change is achievable and worth striving for, and depending on the type of person you are, perhaps inevitable. So there are still many challenges to navigate the system, but I thought it might help to provide a little context, and then move into providing some context about why the challenges that remain are still in place, just so everyone can kind of better understand how they got there and why they still persist. So from a medical perspective, like a Western medical perspective, there's a difference between being trans-identified and having a psychiatric diagnosis of what's called gender dysphoria. And gender dysphoria is described in a manual that guides physicians called the DSM. That's the Diagnostic Statistical Manual of Psychiatric Diseases. And the DSM lays out specific reproducible experiences of trans people who have historically benefited from hormone therapy and or gender affirming surgeries. So these experiences, however, are based on research from studies done in a more binary time and context where gender was much more rigid than it is now. So applying this diagnostic model, which is based on experiences of patients before non-binary identities were so prevalent, it's like having a harm reduction approach to prescribing hormone therapy. If you're going to give hormones to someone who doesn't fit into that really binary kind of model that the DSM is based on. And if you do that as a prescriber, you might be increasing what some people are afraid of, which is the risk of regret, or sometimes in the medical literature, it's referred to as a rate of detransition when people make a change and decide not to continue hormone therapy, for instance. And the risk of this, from a prescriber's perspective, is that you might cause irreversible harm to the patient if their body changes in ways that we're not able to change back. So cautious prescribers have to choose whether they want to sort of be evidence-based and be very strict with what the DSM recommends, and then exclude patients who don't fit the mold that's described in the DSM, or take a harm reduction approach and provide hormones in case they might help. So, many prescribers are just not comfortable or willing to assume that risk. And so there aren't a lot of prescribers yet. So another example, I think it's a barrier currently, is application forms for surgeries in the Atlantic provinces were developed in a true effort to move away from the DSM and use the World Professional Association for Transgender Health Standards, or WPATH. And WPATH is an international organization that makes great effort to center trans competent, experienced, interdisciplinary care. But the contributors to the WPATH standards work, I think, mostly in major urban centers with vast resources and large numbers of trans people, both patients and prescribers, trans prescribers. Here in the Atlantic provinces, without dedicated teaching and supervision widely available, and with our smaller population sizes, many prescribers will look at the application for surgery, read the recommendations of what qualifies someone to competently diagnose or refer for surgeries, and just feel underqualified, sometimes undertrained, and most of the time undersupported. So they're not willing to complete the forms. And then, of course, trans people are still stigmatized and misunderstood by power holders in government and healthcare. So we see things like ancillary fees, like extra fees for things like top surgery that run into the thousands of dollars being offloaded onto patients. And if we charged breast cancer patients thousands of dollars for their surgeries, it would be outrageous. It would be unheard of. But we're treated differently. Our health is treated as if it matters in a different way. You know, surgeries that are funded by public health care are still genital focused, and they're not based on morbidity and mortality data about the lived experiences of people. And what I mean by that is, you know, for instance, things that are not routinely covered across the country under Medicare are things like breast augmentation, vocal coaching or vocal therapy, and facial feminization surgeries, which are all frequently cited as services that would positively impact the lives of trans feminine people, but they go unfunded. We have minimum age limitations for treatments. You know, in New Brunswick, you have to be, well, I think it's, I'm gonna say it's no, every province is a little bit different. So, but in New Brunswick, you have to be 18 if you're going to have Medicare pay for surgery. You know, but imagine being like a 14-year-old with a cancerous tumor. You don't have to wait until you're 18 to have it cut out, you know, but trans people do. You know, and then the fact that we have to do mental health evaluations prior to our surgeries is, again, just not the standard that's applied to cisgender people. You know, if I have a patient who wants to have a vasectomy, they do not have to speak to a psychiatrist before they go ahead and do that. But it's a surgery that will impact things, you know, like their fertility. So there's a real double standard that's still applied, you know, that I think is not fully inclusive of what the health needs are of the community. And these are just some of the policies and practices that still need to be changed. So it's important, I think, to feel encouraged by our history. You know, we do win, we win a lot, but we've got a lot to keep advocating for. Thanks.
Thanks so much for that. I think that historical context as well, just reflecting on that is so very important. So thanks for bringing that forward. And a lot of those pieces you mentioned are so important. So I hope we have a little bit of time today to kind of dig into some of those a little bit more and look at the context in Atlantic Canada for I think a lot of those pieces. In particular, when we're talking about access to care for trans and gender diverse folks, and I think the requirement for biopsychosocial assessments, and then, you know, a lot of the time who's doing those assessments, primarily cisgender people, and what that means in terms of power imbalances, you know, and we're not really approaching that often in a way that is taking an anti-oppressive approach at the core, right, structurally, because already there's such an imbalance. And so, yeah, that's such an important piece to name and bring forward. And both you and Tye mentioned that. Thank you. Rae, so excited to hear what you have to say. So,
well, I think I'm muted maybe. Oh, sorry. No, I'm, for one, seeing Adrian talk and like seeing a doctor who's also a transgender person who has, I mean, just the emotion that you were showing, talking about the history of it too, means so much because it's not something we see a lot. I started my transition about 4 years ago. So basically I had the fortune, I have some privileges that work in my favor. I'm a white person. I am I have a supportive family, which is not something I take for granted, which is unfortunate that it's something that's rarer than it should be. And I came out to a friend who had come out to me about a week prior, and they had already gone through a lot of the initial navigation of the healthcare system. So I had a bit of a leg up in knowing some of the initial places I could go see. But even at that, so even with that kind of boost, that helping hand to kind of help me initially navigate, because at the time, I would have had no idea where to go. Like I would have not known. I came out, before I came out to my friend, I had come out to my doctor because I had gone into like this nervous breakdown, this psychological crash, and I couldn't eat and I couldn't sleep, and literally didn't eat much of anything that for a week, and came out to my doctor in tears, didn't know what to do. My doctor, nice person. But all she could say is, do you have anyone you can talk to? And I was lucky because I just so happened to have known someone a week before who had come out to me who could help out with this. Like one thing that surprised me just at the moment of coming out was, so what do I need to do if I want to move forward? And the idea, well, you need to be psychosocially evaluated. You need to have a therapist look into this. And you have to have a therapist diagnose. You mentioned gender dysphoria. You have to have that letter that says you qualify as having gender dysphoria to access any treatment whatsoever. And so I checked with my doctor first and I said, like, would you be able to help me once I have this assessment letter? And the doctor said, sure. And so I went to, looking for a therapist. I found out that the public system that we have a long, this is not a surprise that in this province, mental health has not been given the priority it should have. We have an overburdened mental health care system. And of those professionals, my understanding is not all of them are even qualified or capable of, doing the appropriate quote unquote diagnosis of gender dysphoria. And so I had to seek out a private therapist, which is not cheap. I needed multiple appointments and a letter to be drafted. And she was great. My therapist has been great and has been very supportive of the trans community as well. But once that was done, which is in itself kind of like, it was cathartic, but it was also very emotionally taxing, obviously. I go see my doctor and I said, here's my letter. How can we get started? And my doctor's like, I'm not comfortable doing that. And so I'm there in the office, laid bare. I've just been, pulled apart raw by a therapist to get this diagnosis. I show up to my doctor ready to continue, go on with my life. And the doctor's like, I'm not comfortable with this. And basically sends me to, or refers me to an endocrinologist. And at the time, there were really only 2 endocrinologists in the city that would even look at trans people. And one of them was on maternity leave. So I had no idea when I would actually be seen by an endocrinologist. The waiting list was at least a year. And you can imagine someone showing up, diagnosed as having severe clinical depression and going to a therapist being like, the therapist says they have clinical depression. I absolutely suggest this medication for them so that they function and that they do not suffer from ideation and they do not have that. And then your doctor says, well, wait a year. It was shocking. And it's probably the closest I came to not being here today in a very long time. And then, so I put my name, my friend again, who was again, an enormous help early on, suggested I reach out to the Halifax Sexual Health Center, who've been fantastic. And that was something else but even there, that was like a 4-month waiting list because they are, again, overburdened because doctors are not taking this role either. So they're, sexual health centers in this province are taking so much of this, I don't want to say burden, but so much of this task because the healthcare system in general is not serving the trans community, the non-binary community, just even, in some cases just the community, because they fill the gaps with STI testing and such. And they're not made to handle the entire load of the healthcare system on the province. So they're overburdened now. They have long waiting lists themselves. They're doing their very best. I was made aware, for example, that the Truro one hasn't even been allowed to open. So trans patients there are in a rough position where, doctors are not necessarily helping them, and the sexual health center, the government's not letting open up, and that in itself. I was so shocked. I went to my doctor again to try to kind of encourage her to give me the treatment. And so at the time, we didn't really have in this province guidelines for, standards of care for the transgender patient. We didn't have this kind of circulating. I was provided something basically from Sherborne Health Center. This is something I was sent by my friend, and later on as well from the sexual health center at the time, which was just, it's a little dated now. There's some of the terminology is a little dated now. It's from a few years ago, at least, 11 years ago. But I read this in a night. I'm not a doctor. I'm an IT person. I read this in a night, and at the end of reading this, I knew how to dose myself if it came to it. Like, it's not complicated. It is, here are the levels you should be in. Here's the things you should watch for. Here's the things you should ask the patient about. Do they feel right? Do they feel okay? Are they too tired? Are they not? Are your levels at the appropriate place? If you're taking antiandrogens, if you're taking spironolactone, is your potassium too high? These are just like basic things that someone who just has access to your blood work can do. And so few doctors would do this work because they're not comfortable doing it. And what unfortunately that means, and I've known this to occur, is that if the healthcare system fails them, they have to do it themselves or worse. And that shook me to my core. When I came out, it was 2016, which was kind of before the world seemingly turned upside down in a lot of ways. So there was seemingly this feeling of progressive, change and advancement in the world in general. Some of it performative, but there was at least that kind of feeling when I came out, at least more so than when I was, deeply entrenched into the closet. And so here I am, like, ready to put myself out in the world, and suddenly I realized how second class all of this was, if not third class. Adrian, you mentioned something before, which is like the healthcare, and this is something that through my experiences of it, I've definitely experienced, is that the healthcare itself is super fixated on the possibility that's, so two things, that being trans is a terrible fate is one thing that it seems to be the intonation. If you're not the binary gender you were assigned, and I say trans, I also want to include non-binary. I know not all non-binary people will identify under that umbrella, and I acknowledge that, but just to shorthand it, but it's to not be your assigned gender at birth is seen as a curse, despite all of the negative elements of it, or many of the negative elements of it, being tied to the fact that society sees it as a curse. And so that is one problem that I find with the way care is evaluated and provided. And the other one is, as you mentioned as well, is this fixation on detransition, which is a minor percentage point of a minor percentage point of the population. And I feel for everyone who has to, and anyone who has detransitioned, they are just as valid, and they deserve as much care and as much support as anyone else. And they will do it for a variety of reasons. It could just be that their gender identity evolved, or it could be societal pressure pushed them back into it. In either of these cases, the healthcare system is so focused on this, yet we don't ask other things like, what happens, what's the long-term effects of putting someone on hormones? Well, what's the long-term effects of putting a cis person on menopause on hormones? What are the long-term effects of getting a tattoo? Like there's there's so many things that, I mean, hormone therapy as well is generally safer than birth control. So, you know, and yet we have such a barrier to access these medications. And when it comes to procedures and surgeries and corrective surgeries, mentioned before, if you're below 18 years of age, if you're a trans man and your breasts give you, you know, are a big trigger for you, you basically have to bind until you're 18 years old. And people who wonder, like, well, what happens if we do it too much younger? What are the health effects of that? It's like, what are the health effects of binding from the ages of 13 to 18? Like, we're not identifying what the challenges we currently have versus what we might have. What are the effects of giving you estrogen too soon? What are the effects of not giving me estrogen? What happens if I go back home and every time I look in the mirror, I feel awful. Every time I go out in public, I feel awful. Mental health is a healthcare, and I guess transgender and trans affirming care and non-binary affirming care, these are, you know, this is kind of that weird interface between mental health and physical health. But it's very important, and we need to provide this to people. And in terms of like surgery, one thing I've been struggling with in the last year. So right now in this province, the procedures that are covered for trans affirming corrective procedures are, you know, if you're a trans woman, it's bottom surgery. And up until last year, they made an announcement for top surgery. I'll put a pin in that for a second. And then if you're a trans man, you have access to, I believe, like the hysterectomy, the phalloplasty or metrodoplasty. That word always trips me up. And you'll have access to the top surgery. But in neither case is permanent hair removal covered, which is both an immense trigger for trans women and is mandatory for the bottom surgery of trans men. They need it for the graft area. The province will cover the surgery. They will not cover the preparative care for the surgery. And if you're non-binary, you have to tick a binary box and effectively pretend you're one or the other in order to access the care that's most applicable to you, which is ludicrous. Like you're asking someone to basically lie about themselves to access care to help themselves because we don't have the gamut of responses that are required for this. And I put that pin in the top surgery. They made an announcement last year ahead of Pride, indicating that after years of a legal challenge, of ongoing legal challenges, that there was a condition, if you are a cis woman in this province and healthcare professionals say you should have access to top surgery, you're evaluated by the physician. You're evaluated possibly if the physician decides it's necessary, you're evaluated by a therapist or someone as well. But then if it's deemed as like, no, this has a benefit to the patient, we will refer you to top surgery. And you know, this could be for any cases. It could be for little to no growth when you're developing. It could be due to trauma. It could be due to cancer and mastectomy, whatever. So long as a healthcare professional evaluates you, it is case-by-case basis. They will evaluate you and you can get access to that procedure. If you were a trans woman, you were disqualified initially. You just, no, we don't provide this because you are trans. And that was legally challenged on the basis that you can't discriminate someone based on their gender identity. You can't say, no, we will not provide you care that a healthcare professional says would be helpful just because we didn't agree with the gender you actually identify as versus what you were assigned. And so they made that announcement and I immediately started reaching out. Like, okay, well, what are the conditions here? For two reasons. One, would I qualify? Because I did not I was not blessed by the gods thusly, but also because I was getting a lot of pushback and a lot of questions myself from people in the community, as you know, both with good intentions and bad intentions, talking about what this meant. So I reached out first to MSI and then the Department of Health and Wellness and then the Health Minister's office. And I eventually got to a staffer with the Department of Health and Wellness. And this was over the course of 5 or 6 months as a private person just trying to reach out and get details. And I asked basic questions like, because one thing I noticed was they put a limit specifically seemingly on trans women, that would disqualify you from this care. Which is called the Tanner stage limit. And I suppose for anyone who can see the screen, I'm going to show a thing. This is the Tanner stage chart. It is a it's not a particularly scientific thing. It is just kind of a best guess of where you developed in your sexual characteristics, in this case, breasts and pubic hair. And if you are there are 5 Tanner stages for breast development. And if you are a trans woman and you were evaluated at Tanner above 2, which means the level, so Tanner 1 is prepubescent, Tanner 2 is budding, and then Tanner 3 and 4 and 5 are kind of this nebulous region until you get to what they claimed was a developed breast. If you were evaluated at above Tanner 2, you would be disqualified. And so I tried to get clarification. Do cis women have this same limit? And after numerous back and forths, never getting a direct answer, but generally getting the answer of, well, for a cis woman, it's a case-by-case basis, meaning that they put a limit in place. And I will say that most people, including trans women, will go above Tanner 2. Therefore, the limit was seemingly specifically put in place to just not allow trans women. To say that they did it, but they didn't. I won't ascribe motives, but that to me is what it came across as. And I got evaluated as Tanner 2. And so, okay, cool. So let's go to the next process. Who do I reach out to? What do I do? What are the forms? That was another 4 or 5 months to get some of that information, some of that detail. It's been a back and forth. I've been denied things I was told was for things that I was told were valid. I've then been approved for it. The different elements of our healthcare system were not informed or what the limits were and what should be done. I reached out to my doctor, my endocrinologist, my therapist, Pride Health, neither of which seemed to have been informed by the ones putting this policy in place, what was needed to act on this policy, to help people navigate this policy. To date, I have still not been approved, and I'm still working on that approval. That started last, I believe, May or June. So it's in this, I am fairly good at navigating phone systems. I have dealt with politicians before, and I have, again, privileges. I have a job that affords me a lot of this flexibility. Not everyone has this, and even with everything, all of that going for me, it's been such a struggle. And all of these limits, literally, if I bump into them face first, it means that there's countless people who are not being treated by the system at all, or are being neglected, abandoned, or worse. And so this is why, I probably rambled on a little too long now, but this is why talks about healthcare, transgender healthcare in this province mean a lot to me. I have a friend in Truro who's currently worried about the future of the only clinic she can get care at because they're not being allowed to open because we're seen as a secondary health concern, not as a primary one. And again, just the fact that I don't want anyone else to go to their doctor in the state that I was in when I went to go see my doctor and have the doctor say, well, we'll put you on a 1-year waiting list because I'm not comfortable working with this.
Thanks so much, Rae, for sharing your experience. I think there's so many pieces to talk about and unpack. So I'd like to invite the panel to participate. Before we do, we did receive a comment. I just would like to show this. Can everyone see it? So that's very nice. But yeah, Tye or Dr. Edgar, would you like to respond or speak to any pieces or respond to each other?
Just definitely a lot of things. I definitely hear you and have experienced some things. Just in terms of like, even with some doctors, trans people don't even feel comfortable even talking to their doctor about being trans because they feel like they won't get any care at all because the lists are so long for doctors. And yeah, for myself, the barriers for non-binary people who don't identify as female or male, and having to click a certain box, but non-binary people also sometimes, and in my case, have complete gender dysphoria, but just can't get to the place of, for whatever reasons of, saying you're male or whatever. Yeah, just the challenges that are out there and navigating systems. And I really feel that I've experienced similar to you, and that just I have a lot of things going for me. I have a good job. I'm I can articulate myself. I can advocate for myself, but still I've faced so many barriers and struggles. And even now, like, a lot of trans people experience depression and anxiety, and I also experience that. So I've had many barriers, and even now, I'm at the point where, it's just so tiring to keep pushing to do these things that would make you feel better, but it's just such a struggle to get there. But at the same time, I encourage people who can to keep pushing, and I still self-talk to myself, keep pushing, try to figure it out in any way you possibly can. But yeah, those are just some thoughts that I had.
Thanks, Tye. It's really interesting because I think there were so many pieces that came up that as someone who works within healthcare and is looking to sort of help support people navigate some of these challenges. I came into this role about a year ago, and from out of province, and then even trying to understand for myself as someone supposed to support people through the system, like, how do people do this? Right? Like there seems to be so many different pathways or ways that people have, talk to this person, or this physician will help you, or, a lot of the times, as you mentioned, a lot of the physicians specifically here in Halifax that are trans informed or work with trans and gender diverse folks, like, they're filled up. Right? Like, because people know that they are informed and they can do the care. And so the wait lists are really long. And so when especially I feel like at Pride Health, when people contact us and say, like, listen, I really need to get in touch with someone who can provide me with this care, and we just don't have anywhere to direct them, right? And that's something that's really challenging. And I think another piece that's really challenging when we look at our healthcare system, it's really systemically transphobic, and it's really systemically, homophobic. And even when we look about, like, who's working in the system, because like a lot of folks had said, like, a lot of people who are working in the system are cis or are straight or or white, but especially when we look at the Nova Scotia Health Authority, we don't have 2S LGBTQ plus folks as an equity hire group, right? And so, there's, like, even just to get your foot in the door in terms of working in healthcare, we're not actively looking to support trans or gender diverse folks to be employed within the system. And I mean, I think there's a lot of barriers, but that's a huge barrier. And I'm naming that because it's been named. And I'm like, when is this going to happen, right? Like, these things need to happen. And I know a lot of the time within big systems like healthcare systems, we've said, like, hey, it's a bureaucracy. And this has been said, things move slowly. But we've seen what can happen with COVID-19. We've seen rapid responses. We've seen how people can mobilize quickly, can redeploy when there is energy and effort and there's a desire to do the work, it can be done. And I really wholeheartedly believe that. I just think that like we need to have like this collective mobilization around the importance of providing safe and affirmative care to trans and gender diverse folks. And I think trans and gender diverse folks, in my opinion, need to be centered in that conversation because exactly like you said, Rae, when we see the Department of Health and Wellness making policies around trans and gender diverse care, and essentially they're the ones putting in the limitations around who can access care, what's funded, what surgeries are available, they're not getting it right, you know, and they're not necessarily, and we've started to have those conversations, but we need to be having those conversations with trans and gender diverse folks, right? So I'm not going to really say too much more, but was there anything else that you folks wanted to name as important or just put out there before we kind of see if there's anything else from the audience? Or we are like, we're burning through our time. There's so much to say in so little time.
So there's one thing I did want to bring up, actually, when you bring that our voices aren't there. So one of the things I kept pushing the Department of Health and Wellness on was, who did you consult to get this Tanner stage, for example? Like when you made this limit, who did you talk to? It took a couple of months to get an answer that they based it on three jurisdictions, and the three jurisdictions were three provinces that have their own problems in accessing gender affirming care, and including one province, which is the first one in Canada to roll back LGBT rights in history. I asked, so who did you consult with? Are your consultants, did it include a trans person? Did it include someone who at least has had, experience treating trans people? And they put that under like anonymity. They're saying, we do not divulge who we consult with. So as far as I know, they consult with no one. I can't say that for sure because they're saying they're not going to divulge who they consulted with, but without any evidence of the contrary, I have to go under the assumption that they either consulted with no one or they consulted with a cis doctor with no experience with trans patients. And that these issues and these challenges that we have as trans people in the healthcare industry, they compound any other bias in, systemic issue within the healthcare industry. If you're a trans person of color, you have, you have all the challenges that people of color still have in the healthcare industry, including, all of these awful stereotypes and disproven race science nonsense that, still aren't systemically embedded in the healthcare industry, plus the fact that trans healthcare isn't taken seriously. If you are, and even just within the binary, I had a minor surgical complication from my bottom surgery. It involved me having to go to the ER one night. And the ER doctor was so uncomfortable dealing with a constructed vagina, which I want to clarify, looks like a vagina. There's no like a surgically produced vulva and vagina. They look identical to a layperson. And the doctor attempted to speculum me in the urethra, to the great horror of the cis woman nurse who was accompanying him. But I suspect the doctor either made that mistake because they definitely don't see enough women in their practice, or trans men, or basically anyone with vulvas in general, or they were so uncomfortable with the idea of a surgically constructed vagina, they didn't actually think about what they were doing. And neither reflects well on that situation. So it's just, we got to recognize that we compound these issues so that and this is why I acknowledged my privileges at the start, it's this hard for me, and I have things going for me that are easier than other demographics.
If I could say one thing, because I do like to be hopeful, It's so much better now. Like, I do want to go back to that point because I hear that it's still very challenging for everyone. And I'll just say I'm very encouraged by the colleagues that reach out to me after a situation like that. I don't know the doctor that did that, Rae, but doctors who do fumble when they're caring for trans people, so many, dozens and dozens and dozens of them have reached out to me for guidance and clarification, for resources, asked me or other trans people to give talks to their hospital staff or at their, annual general meeting. And I really, what I see happening with Pride Health in Nova Scotia is so encouraging. I really think the majority of healthcare providers want to do better and are not trying to be adversarial. They have not received education about how to care for trans people in med school. It's a very recent addition to the curriculum and still very small. And I just hope that people feel safe, a little bit more safe than maybe we naturally do when we seek healthcare. So I really think the majority of people in healthcare want to help. They might not know how, and they're just getting there. So I hope we keep hope that providers are really, we're getting better. Providers are getting better. They're trying. I really think that. I wouldn't say it if I didn't.
And I will add to that, Dr. Edgar, that today at 1:00 today, Pride Health is hosting a training. So before COVID, it was an in-person training, and because after, so some things change in a positive way, right? When we're able to do things online because more people can participate. So it is a training for primary care providers around gender-affirming hormones, and we have 75 providers who are attending this training. And one of the big questions that we've asked people is who will be taking on patients after you have received this training, and then asking people to participate in a community of practice after. Because we, like you said, Dr. Edgar, we see that providers are unsure and they want to get this training. And then we're also going to be able to have this training online now because of the COVID situation for more providers to be able to take and increase their competency. So I will say, I really feel hopeful about this. And I think that this can actually make a big shift in the large wait list that we're seeing right now for gender affirming hormones specifically in Halifax, but across Nova Scotia and ideally across Atlantic Canada. So, there are some things that we're really hoping to put in place that are going to help the community have quicker access to affirmative care. I don't want to leave it with sort of the last piece. Is there any, just before we sort of sign off, because we're kind of done for time, do any folks want to just add any last piece, or is there something we missed? Yeah, Tye.
Yeah, just to add a little more positivity. Also, I went to the CPATH conference last November, and some positive news would be that the Standards of Care 8 that will be coming out will be more flexible. And apparently they couldn't tell us everything, but there should be more flexibility for people who are non-binary and getting what the care they want. And there's also a lot more trans and gender diverse people on the committee to make the standards this time. So it sounds very promising in where we're going to go. Really looking forward to that coming out. So hopefully things will continue to just improve in terms of giving doctors and health professionals less boxes to tick off to make it easier for them so they feel less risky, because people are probably trying to protect themselves and their livelihood, and also having more doctors trained to give more care and whatnot. So, yeah.
Just a really quick note, I'll add really quickly. I mentioned sexual health centers. They are very pivotal, very important in this province. Donate to them if you can. My doctor at the sexual health center has been a darling and has been super supportive of me. They are filling in some of the gaps that we still have in our healthcare for the time being. So donate to them if you can, and also possibly reach out to your MLAs to open up the ones that they haven't allowed to open yet, because there's people being left behind.
All right. All right. Well, thank you so much, everyone, for joining us today. I wish we had hours. You're all fantastic, and I've learned so much. So thank you so much, and take care.
Thank you.